You may have just heard of the word of hospice for the first time and have 100 questions to ask. Today, I want to spend a few minutes with you and try to answer some of the most important questions about hospice care that you may have. Hi, I'm Matthew Cox with Nathan Adelson Hospice. Simply put, hospice care is a specialized healthcare for people dealing with life-limiting illness. Hospice care helps to improve quality of life so that you or your loved ones spend every day free from pain or suffering. With over 40 years of experience, Nathan Adelson Hospice is recognized as Southern Nevada's hospice of choice, employer of preference, and training center of excellence. To help you and your loved ones better understand the benefits of hospice care, here are some of the most common questions we're asked. Do I receive 24-hour supportive care? Each patient and family have a case manager that works directly with them to determine the amount of care that your loved one needs. What makes hospice care unique is a team of highly trained professionals supporting our patients and their loved ones. Nathan Adelson Hospice specialized care teams include physicians, advanced nurse practitioners, registered licensed nurses, certified nursing assistants, social workers, spiritual care professionals, and specially trained volunteers. You can expect routine visits to your home throughout the week. In an emergency, support is available 24 hours a day, 7 days a week. Professional members of our team are just a phone call away at 702-733-0320. At Nathan Adelson Hospice, we encourage your physician to continue to serve as your primary doctor. Working in collaboration with our medical team, your primary care physician is invited to attend conferences and can oversee your plan of care. You can expect to be included in these important and valuable discussions. Can I live in your inpatient facility? We understand that most patients and their families prefer to be in the comfort of their own home, in their own surroundings. Yet Nathan Adelson Hospice is fortunate enough to have 2 inpatient facilities. Hospice care in our inpatient units are intended for management of pain and symptoms that cannot otherwise be managed in a home setting. If you or your loved one require care in our inpatient setting, you can expect to return home within a few days. Will my insurance cover hospice care? Medicare patients are fully covered for all Nathan Adelson Hospice services related to their terminal illness. Typically, there are no out-of-pocket expenses. Private insurance and HMO plans will often cover hospice services through a specific hospice benefit or through hospital, home health, or private duty benefits. Our list of insurers can be found on the link below. We've also produced an additional video and blog article that explains a little bit more about the cost of hospice care. Please click on the link below if you have more questions. Do you pay for housing? No. If a patient is in need of housing, our social workers will help to identify available community resources. Will hospice cover my medication? Medicare and major insurances usually cover all costs of medications that are related to a terminal diagnosis. For example, if a patient wore glasses prior to entering the final stages of a life-limiting illness, the glasses or eye exam would not be covered, but any medications for the disease itself would be covered. How long can I stay on hospice care? The time period for hospice is not set in stone. There's no book that tells you that you can be on hospice care today and off tomorrow. Hospice care is unique to you or your loved one's medical condition. Every patient's condition and experience is different. Each of you will meet with a case manager and a team of caregivers that will determine when it's appropriate for you to be on hospice care and the amount of time that you're on hospice care. Will I have to have a feeding tube? As mentioned, every patient has their own unique experience to their specific health condition. Offering the utmost respect at all times, we strive to provide medical interventions that support your goal and best address your medical needs. Some patients may determine that they'd like a feeding tube, and other patients may determine that that's not what is appropriate for them. Our care team will collaborate with you and your primary care physician to determine necessary and most effective treatments. Will you still feed patients on hospice care? Hospice care neither prolongs life nor delays death. If patients can or desire to eat or drink, they most certainly can. If feeding interferes with the comfort of you or your loved one, then the intake of food can be discontinued. What is the difference between for-profit and non-profit hospice? Our Nathan Adelson Hospice Foundation raises money so that we can provide care to uninsured and underinsured members of our community. As a mission-driven organization, we also provide additional supportive programs and services not funded by Medicare or private insurance. Based on medical needs, our patients often benefit from these additional services. These are just a few questions we are asked on a regular basis. For a more in-depth article on what hospice is, please click on the link below. I hope this time together has been able to answer some of your questions about hospice care. We're available to you 24 hours a day, 7 days a week if you have any questions. Please feel free to call us at 702-733-0320. Thank you for watching, and we look forward to caring for your loved one.